Welcome back everyone to another episode of Quick and Easy, a series on the Easy Med channel where medical topics are made easy in a couple minutes. Today you're going to be given a simple mnemonic to remember some common causes to lower GI bleeds. So the mnemonic to remember here is DRAIN. D stands for diverticulosis, R is radiation, A stands for ABM or angiodysplasia, I is IBD, this is inflammatory bowel disease which includes ulcerative colitis and Crohn's disease, I also stands for ischemic colitis, and N is neoplasm. Now, which one of these are the most common? It's diverticulosis, and you need to know this for examinations as well as practical use. Now, how can we diagnose lower GI bleeds? Colonoscopy is the test of choice, but it's not always possible, especially for brisk bleeds or life-threatening bleeds. You could also do an angiography, which is great because it could potentially help you localize the site of bleeding, and you could potentially perform direct intervention, doing things like embolization or vasopressin injections. You could also do a tagged red blood cell scan. However, this might not show you the site of bleeding like an angiography can. And finally, a CT abdomen and pelvis may also show you findings as to why the patient is having a lower GI bleed. This could include findings of neoplasm or other causes. Now, how do we treat lower GI bleeds? You're going to want to perform supportive care. The patient may require transfusion of blood products. This could include packed red blood cells or platelets. The patient may also require anticoagulation reversal, and you might need to use things like vitamin K, FFP, PCC. The patient may also require embolization, which we talked about before when discussing angiography. Endoscopic coagulation is also another treatment option. And lastly, surgical resection. There will be a video in the future that talks about GI bleeds more comprehensively, but hopefully this mnemonic gave you a simple way to remember some common causes to lower GI bleeds. If you found the video content useful, don't forget to subscribe, like, or comment below. That way you don't miss out on future episodes that make medicine easy. You can also follow EasyMed on Instagram at EasyMedLearning. Daily high-yield content is posted there that will help you with classes, examinations, or even practical use. Thanks for watching. Hope you check out future videos.